This Understanding the Young Child, we are going to be presenting the topic of breastfeeding for the first time for young mothers. So here we go. I want to say a shout out to Kush Cuthbertson Sewer, who presented this for one of her nutrition classes at Texas Women's University. This is a handout that she created for this topic of breastfeeding. It's called lactation. And the audience is new mothers who are breastfeeding for the first time. So these are the reference. She actually created a recipe for successful deep latch for new mothers and newborns. So we have a format of a recipe format. So here we have the time. Feed baby on one breast at a time until each breast is empty. Serving, supplies, infants on demand, nutritional information, immunological agents, proteins, minerals specifically bound for absorption by the baby, and fatty acids that help develop baby's brain and spinal cord. Ingredients: relaxed mom and calm baby, comfortable area to sit or lay. Steps: look for baby's feeding signals. So we have 4 steps for this recipe of breastfeeding for new mothers. Look for baby's feeding signals: moving lips, bringing hand to mouth, turning head side to side. Choose position appropriate for baby. Cross cradle and football hold are best for infants new to breastfeeding. Make sure the baby feels secure. Neck should be straight with air, hip, and shoulder in line. Gently rub nipple on baby's top lip, allowing baby to open mouth wide, like he or she is yawning. Quickly and gently bring baby close to you so the baby takes a big mouthful of breast. Move fingers away from nipple to allow baby to take big mouthful of breast, as you can see from the picture. So the final product is baby should be feeding from breast, not from the nipple. So from the entire breast, the full breast. Chin is pressed into breast, not away from the breast, as the picture is seen here. Cheeks should be rounded, not cheeks that are sucked in. Motion of jaw. Jaw should drop distinctly as baby swallows. So successful latching means more milk is consumed by the baby. And this is one of the issues that new mothers have, is that they feel their baby is not getting enough of the milk. So let's take a look at a text that I'm reviewing for Macmillan, and it's called Infancy and Toddlerhood. It's a part 2. And we're looking at healthy nutrition and specifically nursing. It can be hard for parents, but fascinating for, a big brother. There's a picture here of a parent. They're making nursing easier on parents and babies as a professional lactation consultant near her home in Beijing, China. So we have lactation consultants who can actually support new mothers in their quest for breastfeeding their babies. One of the biggest questions parents have for healthcare providers is what they should be feeding their babies. We know now that there are tons of baby formula that is being recalled on the market in the United States. And because of this, it is important that we are breastfeeding our babies. A Texas mom says her infant died after consuming formula that was later recalled. This is in Rio Grande Valley. A mother claims her infant son died from a bacterial infection after consuming powdered infant formula that was later recalled. We have Pensacola, Florida. We have Billings, There's a city in Billings in Wisconsin. So it's Arizona. We have a pandemic going on with breast milk formula. Chicago, there's a lot of different places. The Wall Street Journal just did a story on that. So it is important that we look at what's going on and realize that it's time to take control of our lives and our children's lives by giving them the best start. So when it comes to breastfeeding, in some places, babies are not fed at all for the first days of life. In others, infants may be given special tea, honey, or formula, according to a 2018-2017 research. Regardless of where they live, all infants must be fed frequently because their small bodies can handle only tiny servings and they need extra nutrients to fuel their rapid growth. So, human milk, experts agree that babies should ideally be fed only human milk from birth until they are about 6 months old. So, human milk is a complex and living concoction of stem cells. You know, there's been some stem cell research because stem cells have been the foundation for healthy living, and there's a lot of nutrients within the stem cells that can be immune boosting antibodies, immune cells, and disease fighting, according to a 2018 research, disease fighting protein. So, human milk is a complex and living concoction of stem cells, immune boosting antibodies, immune cells, and disease fighting proteins. I'm going to say that again because if new mothers are finding it hard to breastfeed, it's time to get consultation. It's time to contact www.Niga's Education World Specialists, www.nigaseducation.com. Niga's Education. That's all you got to put in the search bar. Negus Education. And you'll find our website where you can get help. You can get information on breastfeeding your new baby. So, some mothers, new mothers, have a hard time breastfeeding or producing milk. It's not always easy. And it depends on the food that you're eating that is going to produce the breast milk. More than 8 in 10 nursing mothers in high-income countries report difficulties with expressing milk, including breast infections and intense nipple pain. So difficulties are more common for adoptive or transgender parents who may be able to express human milk and nurse, but often lack the medical and social support to get started. You do not need to identify as a woman in order to create human milk. Okay, with hormonal support, breast tissue many people can support infant development. So if I get hormone treatment right now, I can produce some breast milk. Some people feel uncomfortable with the gender labels for expressing milk, so they may prefer the more neutral term of chest feeding to breastfeeding. So let's get to the nitty-gritty of breast milk. Is human milk magic? Benefits of human milk. It makes children smarter and it reduces their risk of developing an unhealthy weight. We have a big obesity problem in the United States where children 13 are 300 pounds, 200 pounds. Why is that happening? That's an unhealthy weight. For many caregivers, especially those who do not identify as women, those who work and those who have certain physical conditions, expressing milk can be challenging or impossible. So some families may feel judged for not feeding their infants human milk. They may feel judged according to a 2021 research. What is the evidence for the benefits of human milk in this sometimes sensationalized discussion? Well, scientists have investigated the benefits of human milk through large observation studies of families, comparing babies who receive human milk with those who did not. So there's been some studies, correlation studies, and they found that babies who receive human milk are less likely to die early in life or develop diarrheal and infectious diseases, according to a 2020 and 2016 research. I'm coming with the receipts. I'm coming with the evidence. Don't attack the messenger. Okay? I am giving you information that can help you and your child. Some studies have found that benefits continue after infancy. Babies who receive human milk are at a lower risk for unhealthy weight, diabetes, and heart disease when they are older. This is from a 2019 and 2017 study. Some research even suggests that babies who receive human milk score slightly higher on intelligence tests later in life and may have an easier time regulating their emotions. 2018 studies. There are benefits for people who express milk too, including lower risk of heart disease, cancer, and depression. So for new mothers, when you express your breast milk, when you squeeze it out, when you pump your breast milk, you are lowering your risk for heart disease, cancer, and depression. Postpartum depression happens because women are not breastfeeding their babies or they're not learning how. So they go into a postpartum depression. All right? Some of the associations between human milk and children's outcomes are very strong. Others are weaker. For instance, babies in low-income countries are about 14 times more likely to survive their first birthday when they receive human milk instead of formula, which is a strong association. This is a 2019 study now. However, babies who receive human milk have intelligence test scores that are only 0.2 of a percentage point higher than formula-fed babies. This is a smaller association. So there is some stronger evidence also comes when there's a testable explanation for why the relationship occurs. So when we're looking at breast milk, we're looking at the benefits of breast milk. It far outnumbers a formula milk. Okay, research has shown that, and there's evidence to back it up when it comes to feeding babies. All right, and in the United States, we have this, idea. It's a capitalist country. If you talk about breastfeeding in the United States, the baby formula companies are going to come after you. And they're going to want to discredit you. They're going to want to discourage you because they're making money off of you. So around the world, parents who work often have difficulty sustaining nursing because they do not have adequate breaks or a place to pump. So for this reason, it is important for employers to provide a place for women to breast pump and to have breaks to breastfeed. It's important. We have a strong information network that people are using, the internet, for information. I like to use research. What does the research say? Because this research can help you to be a better mother and to be a better new mother nursing your baby. So I'm going to end this workshop, and we're going to look at continuing this conversation further on breastfeeding for new mothers.